Hello and welcome. India's COVID chart has showed an improvement. India has reported 33,376 new COVID-19 cases. That's a drop of 4.5% from yesterday. 308 deaths were recorded during the same period. India's cumulative COVID-19 vaccination coverage has achieved or reached the 73 crore landmark. COVID-19 continues to decline gradually in Kerala, and as a result of which the new infections recorded in India have dipped below the 38,000 mark on Friday. But fears of a COVID-19 third wave still loom large in India, especially with the beginning of a festive season. So, under these circumstances, what do you need to know and what do you need to do to protect your loved ones and yourselves? Joining us in conversation is Dr. Randeep Guleria of the All India Institute of Medical Sciences. Dr. Guleria, thank you so much for your time. As usual, first and foremost, the good news, a gradual dip in COVID cases. Does that hint at an ebbing of the Kerala wave?
Yes, there is a downward trend. So one is hopeful that it is sustained, because we will need to look at it over a period of days that it is sustained, and then one could say that yes, the trend is decreasing in Kerala. But we need to keep a vigilant watch in other states, especially the northeast states, because there is a rising trend and our positivity rate there is high, and aggressive action need to be taken in any area where the positivity rate is going up or is high, because that could be the beginning of a surge in cases in that area, and that could spread to other areas.
Yes, we are reporting today that Mizoram is reporting over 1,000 cases for 4 days in a row. I think that's what we've been carrying. Dr. Guleria, in this context, Prime Minister Modi on Friday held a high-level COVID review meeting where he said that we need to ramp up our medical oxygen capabilities, etc., so that basically that we should not be caught unawares like we were in the second wave. Do you see an awareness amidst our administrators, etc., of that?
Yes, I think there are a lot of lessons that we learned from the second wave, and the first lesson was not to take the virus lightly and not to be complacent, as we were a little bit, I think, before the second wave. And therefore, there is a lot of aggressive planning which is going on. Although many of us feel that the subsequent wave may not be that bad, but it's always better to be over-prepared rather than under-prepared. And therefore, whether it be hospitals having their own oxygen plant, a PSA plant, or having oxygen storage capacity in large cities so that there is a buffer stock available, or whether it's medicine, both for adults and for the pediatric age group. That strategy has been developed. There is an investment for that. Also, there is a strategy of surveillance, because I think the other important issue was that we had a new variant which emerged, which led to this huge surge in the number of cases during the second wave, the Delta variant. And we need to have aggressive genome sequencing, aggressive surveillance, so that we can pick up any new variant and be able to see that is this a variant of interest, is it a variant of concern? If it is a variant of concern, is it going to lead to more cases? Will it lead to more death? Or will it lead to breakthrough infections and cause more reinfection and people with vaccination also getting infection? So I think that network is also being strengthened, so that we are able to pick up more and more variants by aggressive genome sequencing.
Well, that's what the Prime Minister actually emphasized on yesterday. Though all the headlines were about him saying how we need to augment our medical oxygen, he did say that we need constant genome sequencing to monitor emerging mutants. That's what he had said in that COVID meeting. But Doctor, that meeting also came a day after the Union Health Secretary, Rajesh Bhushan, had said that India is still going through a second wave and it's not over yet. Now, according to the data, as many as 35 districts are still reporting a weekly COVID positivity rate of over 10%, while it's, I think, 5 to 10% in at least 30 districts. Are we still in the second wave?
So many parts of the country haven't still seen the end of the second wave, and like we've seen, the pandemic actually occurs from region to region. There are areas in our country, large areas in our country, where we could say that the second wave is over, but there are other areas where we would say that the second wave is still on. And therefore, if you were to look at it as a whole country, one could say yes, the second wave has still not ebbed. And remember, when we talk of the number of cases, we always compare it with the peak that we had in the second wave. But if we were to compare it with the peak that we had in the first wave, then we still have almost 40% of cases that we saw in the first wave still being reported. So we can't say that the second wave is over in certain parts of the country. And that's why at a national level, we are still seeing the tail of the second wave.
And certainly not a time to let down one's guard, right? All these gains that we've had so far could be easily upended with the festival season around the corner.
Yes, that's the most important thing, that we have made major gains, and we also have had a lot of pain and suffering during the second wave, which we should not forget. So I think the two things, that the type of situation that we had during the second wave, we should not have. And we should not lose out on the fact that currently we are in a much better situation than many parts of the world. We have to work on sustaining this. So when it comes to the festive season, when it comes to the crowds developing, when it comes to COVID appropriate behavior, and then when it comes to vaccination, I think all of this we need to push aggressively amongst our population, address issues which may be there in relating to any of this. And I think if we are able to do this over the next 2 to 3 months, we should be in a much better position.
Let's not forget the coronavirus infection spiked after Onam festivals in Kerala per se. Doctor, now there's a lot of news reports, a lot of coverage about breakthrough infections, right? That's when a person who's already been fully vaccinated still contracts the virus. You hear so many stories of that. They can either be asymptomatic or have mild to moderate symptoms. What makes a vaccinated person more prone to these breakthrough COVID-19 infections?
So there are breakthrough infections, we are seeing that, and breakthrough infection occurs when you have been fully vaccinated and 14 days after your last shot, so that you have now enough antibodies, but you still get COVID infection. It could be multifactorial. One, of course, is the person's own immunity and how much is the immune response that the person generates as far as the vaccine is concerned. The duration between the vaccine and the infection. So people may have got the vaccine 6-7 months ago and their immune response may have waned to some extent. And thirdly, of course, the variants that are there. How effective is the vaccine against the newly emerging variants? It also depends on the exposure that a person has had to the virus itself, the viral load. But we are seeing breakthrough infection. But I think what the encouraging news is that although there are breakthrough infections, not that much, but none of the breakthrough infection is actually leading to significant serious illness, mortality, or hospital admissions or ICU admissions. So still what we're noticing is the vaccines are still holding out in terms of preventing people from getting serious illness, hospitalization, or dying because of COVID-19, but it's not protecting them from getting infection, and you may get a mild infection or be asymptomatic and you may still be infectious and give the infection to others. So as of now, I think the vaccines are holding out, but we need to closely monitor to see whether there is an increase in breakthrough infections and whether therefore we need to take preemptive action.
So are the COVID symptoms experienced by someone who's fully vaccinated, someone who's got a breakthrough infection, different from the original symptoms? What should one be watching out for?
So symptoms are usually mild, fever, sore throat, cough and body aches. There usually is no respiratory difficulty or fall in your oxygen saturation. It's usually those individuals who may have an immunocompromised state, who may have a little bit more serious illness in terms of pneumonia and fall in saturation. But among majority of the healthy people, it's just like, you could say, like a common cold or a flu that we see as far as influenza is concerned. So it becomes like influenza-like illness, which resolves on its own in 5 to 7 days.
Dr. Guleria, this is, it's complicated because we're right now in this month. I don't know if it's a month or the season where we're just hearing of so many viruses doing the rounds. We're not hearing so much about COVID cases, but we're hearing of swine flu, we're hearing of dengue, etc. How is one supposed to know which one it is that you've been affected with?
So this is the tough situation that we have, because monsoon months are the months where you see both vector-borne diseases, dengue, chikungunya, and then you have a parasite disease, malaria. Also, this is the season when we have a surge of influenza, and we see more of flu-like illnesses, and all of them are febrile illnesses. both COVID-19 and flu cause respiratory symptoms. Dengue usually causes more of fever, body aches, back aches, and you may have a rash also as part of dengue. And then, of course, later on you can have a decrease in platelets or hemoconcentration. But the challenge is that you have to be able to really diagnose it properly, and that's why anyone who has fever now needs to be evaluated thoroughly. It's not only getting your COVID test, but also getting your test done for dengue and for other viral infections, because the treatment strategy is very, very different. And that's why I think we are actually in a little bit of a tough situation, and we should actually work more on preventive measures. So I would still use this forum to really ask people to really be aggressive in terms of preventing mosquito breeding in their area. Don't allow water to collect, especially in pots or on your rooftop, because that will encourage mosquito breeding, and that will lead to spread of vector-borne viral infections like dengue and chikungunya.
So, doctor, none of these tests are inexpensive, right? So when you say that, of course, treatment, you have to know what you are treating in order to treat it. So what would you recommend if someone has gotten a slight fever, a few symptoms? I mean, do they go in for a COVID test? Do they go in for a dengue test? I mean, not everyone can afford to do them all in the first go.
So it's best is to consult your physician. Depending on this most likely cause, you could get a few tests done. If one is thinking of dengue, we get it what we call an NS1 antigen test done in the first 5 days, and after the 5th day we can get the antibody test, the IgM antibodies for dengue. If one is thinking of a flu-like illness, which could be influenza or it could be COVID, then you could take a nasal swab, and get both tests done for influenza and for COVID-19. They can be done in the same lab, and that will help you to make a diagnosis. In certain parts, we have to also look at what is the prevailing infection in that area, and therefore have a low index of suspicion to diagnose that. But the first thing would be to consult your physician, tell your symptoms, and then get the test done.
And the crazy rains that we've seen all of Saturday, all of today, certainly not helping. Doctor, I want to just shift gears. The other big story, of course, this week was that the 5th test between England and India that was finally cancelled. Sources say that Virat Kohli and Rohit Sharma were among those players who said no, it's not worth it. We shouldn't be playing. Has this busted this whole bio bubble concept, according to you? Where do you stand on this? Too much cricket in the times of a pandemic, a bit crass? I mean, we were playing the IPL in the height of our second wave.
So I think the whole concept of bio bubble needs to be looked at very critically, because a lot of it depends on human behavior and how you're able to maintain the bio bubble. It's all right for a short period, but when it goes on for a long period, human behavior is that you will not be able to stay inside that bubble, and you may go out a little bit and may think that this doesn't matter. But we know that this virus is just looking for an opportunity, and therefore I would think that we need to be cautious when we are looking at a situation where you may have a surge in the number of cases, and therefore balance out the risk and the benefit in terms of such sports especially.
All right. Thanks, Doctor. We're going to go in for a short break. I want to ask you, travel is restarted. So some tips for anyone who's planning to take a flight. Let's go in for a short break and come back with more with Dr. Guleria. Welcome back. We're in conversation with Dr. Randeep Guleria. Dr. Guleria, the UAE this week allowed the return of vaccinated holders of valid residence visas, including those who've stayed abroad for over 6 months, including those from India. Basically, travel is opening up. Many Indians have chosen to fly, taking their first flights in many, many months. Any tips for those who have decided they're going to go ahead? How can they protect themselves while flying?
So that's true, travel is opening up and more people have started traveling. But I would say 2 or 3 things. One is we know now more about the virus, and we know that the spread is predominantly by droplets or by aerosol. So the most important thing is that while traveling, especially when you're inside the plane and you're in a close proximity, you must have your mask on, and if you have a surgical mask, you would use a double layered mask or have a face shield because that is the main route of entry as far as the virus is concerned. And use your hand sanitizer more frequently, avoid touching your nose and mouth while you're traveling, and try and be as careful as possible. Also in areas where the positivity rate is high, I think in and out travel there should be restricted or limited, because that is one area where you could get the infection, or someone coming from that area could be carrying the infection and could give it to you. So those areas should be avoided. But I do agree that people have started traveling now with more confidence because of vaccination having gone up. But we still need to have our COVID appropriate behavior as much as possible.
Lastly, Doctor, the other worrying headline coming out of Kerala this week was that the Nipah virus and the virology center team collecting samples. Is this something that all of India needs to be concerned about, or can it be nipped in the bud in Kerala?
So Nipah virus has been reported in the past also in Kerala, and the health authorities there have worked and developed a very good SOP in terms of managing Nipah virus out there, because of the fact that they've had it in the past, and both the managing strategy and preventive strategies are in place. So I think they should be able to nip it in the bud, and it's unlikely that it could spread to other parts as of now. There is an aggressive action going on, but we need to, again, like I said, in the midst of a pandemic, it's always a big challenge if you start having other outbreaks, whether it be Nipah, whether it be dengue or chikungunya, and therefore we should nip all of these in the bud, because it will become a huge strain on the healthcare system to manage multiple outbreaks at the same time.
And finally, Doctor, beyond Delta, we're hearing of these new COVID variants. They're causing a global alarm. This, Delta is dominant, but there's Lambada, which is on the way, and then there's Mu this week that is the one it seems to watch out for. I mean, clearly there are more variants on the way.
Correct. I think what we've always been saying, that this virus will continue to evolve and mutate, and we will see new variants. We've had the Lambda, we have Mu, which has also been reported, and some concern that these may be a little bit more infectious also. They are still variants of interest. We need more data, but I think this also highlights the fact that COVID appropriate behavior and vaccination are important, because it's not that if you are wearing your mask, if you are careful, no matter what be the new variant, you can still be protected. And like I said in the beginning, you need to have aggressive genome sequencing to pick up these variants early, so that aggressive action can be taken and we are not caught off guard. And I think that needs to be done not only at a national level but at a global level.
All right. So, Doctor, before we sign off, I just want to give you the last word. What would you say to our viewers who are watching? Everybody is starting to return to normal, finally going out, restaurants, etc. What do they need to do to protect themselves and their loved ones? Your last message to them tonight.
So, I'd really say that the pandemic is still not over, and we have to really respect this virus. It can come back as we've seen in the past. And therefore, what I would suggest is COVID appropriate behavior is important. Avoid crowds and be careful in terms of sort of having super spreading events.
Dr. Randeep Guleria, thank you so much for joining us. Thank you so much for your time.
Thank you.